It is a subject that can be filled with shame and fear, pain in the pelvic floor and vaginal area. Do you feel tightness, pulling, stinging and pain during sex, or you are completely unable to insert anything into the vagina? Are examinations at the gynecologist impossible for you or can only be endured with pain? Or would you like to have sex, but the pain is just too bad? All of this indicates that you have vaginismus, vulvodynia or dyspareunia. All three are diseases in which the pelvic floor and the external vaginal muscles contract involuntarily in response to touch or penetration. This means that the vaginal muscles become cramped and tense to the extent that the insertion of a finger, a penis or tampon is hardly possible or can only be endured with pain. These symptoms persist even when other sexual reactions, such as lubrication, are normal. Sounds paradoxical, but that's exactly how it is for many women. And as soon as the penetration or the touch stops, the discomfort subsides. All of this is incredibly frustrating for affected women. Many express the desire to have penetrative sex, but it is simply impossible. Many women also report self-doubt, pressure, fear, and feelings of shame because they simply cannot explain what is happening. They endure sex without desire or arousal, fear penetrative sex, and think that it is something wrong with them. Or they avoid sex completely because they want to avoid the pain and embarrassment, which can lead to difficulties either in terms of a partnership or in terms of enjoying a satisfying sex life. Perhaps you have not spoken to anyone about it before because it is a completely taboo subject. In all honesty, there are probably lighter topics of a conversation at a casual dinner with friends or a family celebration. And yet, we can tell you, you are not alone. A whopping 15% of American women report persistent pain during sex, and an estimated 1 to 8% of women report having pain inserting things into the vagina. So far, however, there have been few studies on the subject because many women do not seek help or treatment. Therefore, the number of unreported cases is probably even higher. The good news is that the symptoms can be treated. With our program, we offer you the opportunity to actively work on your complaints and get them under control. Regardless of whether it is vaginismus, dyspareunia or vulvodynia, at 8Plan we believe that it is time to gather the knowledge of the best experts around the world in order to finally offer as many women as possible the chance to be able to do something about the symptoms over the long run. Because we know that nobody has to suffer from this pain. Something can be done about it, and permanently. In the following videos, we will first go into the individual diagnosis in detail. Afterwards, we will take a closer look at the connections between these diagnoses before we start the treatment. So be sure to watch all of the videos. You will probably be amazed how these different clinical pictures are related.